Gentlemen, listen closely, because this is something most men are never told. There is a small area on your body, no bigger than a coin, that plays a critical role in blood flow sensitivity and performance. When tension builds there over the years, circulation weakens, nerves dull, and what once felt automatic starts to feel unreliable. And here is the part that matters. That tension is not permanent. It can be released. I am Dr. Laura Simmons, a board-certified urologist, and for more than 15 years, I have helped men across the United States restore circulation confidence and control using natural science-based methods. What I am going to share with you today is not a trick, and it is not something new. It is a simple daily practice that works because it addresses the root problem most men over 50 are dealing with, but rarely recognize. The biggest misconception is that age itself causes decline. That belief quietly convinces men to accept less. In reality, one of the most common issues I see in my practice is chronic pelvic tension. Years of sitting stress, shallow breathing, and clenching create a constant state of tightness in the muscles that regulate blood flow and sensation. When those muscles stay tense, circulation suffers. When circulation suffers, performance follows. The reason this matters is because blood flow does not just respond to effort, it responds to release. When you remove tension in the right place, vessels open, nerves communicate more clearly, and the system begins to function the way it was designed to. That is why even a short, consistent daily routine can lead to meaningful changes over time. Before we go further, take a moment and tell me where you are watching from. Are you here in the United States, maybe Texas, Florida, California, or the Midwest? Or are you joining from Canada, Europe, or somewhere else in the world? Leave your city or country in the comments. This channel is about men supporting each other with real information, no matter where you live. What we are going to talk about next is why this specific area becomes such a problem as men age, and why addressing it directly can succeed where pills and quick fixes fall short. Once you understand what is happening beneath the surface, the technique itself will make complete sense. Stay with me, because this is not about doing something extreme. It is about restoring control over a system your body still knows how to use. To understand why this simple practice can be so effective, you first need to understand what actually changes inside the male body over time. Most men assume that weaker response or reduced sensitivity after 50 is driven by hormones alone. Hormones matter, but they are only part of the picture. The larger issue I see again and again is mechanical and neurological. The pelvic floor is a group of muscles that sits at the base of the pelvis. These muscles help regulate blood flow nerve, signaling bladder control and stability of response. In a healthy system, they contract and relax freely. But decades of sitting stress, shallow breathing, and constant tension cause these muscles to stay partially clenched all the time. Over time, tight muscles become inefficient muscles. Here is the problem with constant tension. Tight tissue compresses blood vessels. It also irritates nearby nerves. That combination quietly reduces circulation and dulls sensation. This is why many men notice changes gradually, not suddenly. It feels like something is fading rather than breaking. From a medical standpoint, this is similar to what happens when you keep your shoulders tense all day. Blood flow decreases, nerves become irritated, pain and weakness develop. The pelvis is no different. The only difference is that men are rarely taught to pay attention to this area. Many men respond by looking for a shortcut. They rely on pills or stimulants to force blood flow temporarily. While these can help in the moment, they do not restore flexibility or nerve communication. Once the effect wears off, the underlying issue remains. This is where targeted release becomes important. When you apply gentle pressure to the right area, you send a signal to the nervous system to relax. As tension eases, blood vessels open and circulation improves naturally. Nerves become more responsive. Over time, the system regains coordination instead of relying on force. One of the most important mindset shifts for men over 50 is this. Strength does not always come from adding more. Often it comes from removing what is blocking you. Releasing chronic tension allows the body to do what it already knows how to do. This approach fits especially well with this stage of life. Younger men often overpower problems. Older men succeed by understanding systems. When you work with your physiology instead of fighting, its results become more consistent and more sustainable. What comes next is learning where this release happens and how to approach it in a way that feels controlled, respectful, and practical. Once you know that the technique itself becomes simple and repeatable. Now let us make this practical and clear, because this only works if you know exactly what you are doing and why you are doing it. The area we are talking about is not mysterious, but it is often ignored. Medically, it is the perineal region, the soft tissue located between the scrotum and the anus. This area sits directly above muscles and nerves that influence blood flow sensitivity and pelvic control. When this region is chronically tight, it acts like a bottleneck. Blood flow slows, nerve signals weaken. Over time, response becomes less reliable. Gentle, consistent stimulation here helps reverse that process by encouraging relaxation and circulation. Start by positioning yourself comfortably. You can sit on the edge of a chair with your feet flat on the floor or lie on your back with your knees bent. Comfort matters. If your body is tense, the nervous system resists change. Take a few slow breaths before you begin. Using your index and middle fingers, apply gentle pressure to the soft area between the scrotum and anus. The pressure should be firm enough to feel contact, but never painful. Think of the pressure you would use to test the ripeness of a piece of fruit. Too light does nothing. Too hard causes the body to tighten. Begin with slow, small, circular movements. About 30 seconds in one direction, then 30 seconds in the other. Another option is a gentle press and release pattern. Press for 3 to 5 seconds, then release for the same amount of time. Both approaches work because they signal the nervous system to let go. 1 minute is enough. More is not better. This is about consistency, not intensity. Done daily, this small practice encourages the pelvic muscles to relearn how to relax. As tension releases, circulation improves naturally. Using a small amount of natural oil can make this more comfortable. A neutral carrier oil reduces friction and helps you stay relaxed. Warm the oil in your hands before applying it so the body does not react to cold. Timing also matters. Morning use can help stimulate circulation and awareness. Evening use can help release tension built up during the day and support relaxation before sleep. Choose a time you can be consistent with. What many men notice first is not dramatic change, but subtle shifts. A sense of warmth, less tightness, better awareness of the area. These are early signs that circulation and nerve signaling are improving. What we need to talk about next is why this simple practice affects more than just one function, and why men often notice improvements in comfort control and overall confidence when they stay consistent. What surprises many men is that the benefits of this practice are not limited to one area of life. When pelvic tension begins to release, the effects ripple outward. Better circulation supports stronger response. Improved nerve signaling sharpens sensation. But beyond that, many men notice changes they were not even looking for. One of the first shifts is comfort. Men who have lived for years with low-grade tightness often do not realize how much effort their body has been using just to hold tension. When that tension eases, movement feels easier. Sitting feels more comfortable. Some men notice less stiffness in the hips or lower back. Others report fewer nighttime bathroom trips because the muscles involved in bladder control are no longer locked in a constant state of contraction. From a neurological standpoint, this makes sense. The pelvic floor is closely connected to the nervous system that regulates stress and relaxation. When you teach this area to release, you help the body exit constant alert mode. That alone can improve sleep quality, mood, and daily energy. I remember a patient in his early 60s who came to me focused entirely on performance concerns. After a few weeks of consistent practice, he returned and said something unexpected. He told me his body felt calmer overall. He was sleeping more deeply. His confidence had improved not because he was forcing results, but because his body felt more cooperative. This is an important distinction. Men often think confidence comes from pushing harder. In reality, confidence grows when the body responds without resistance. When you feel in control, rather than strained, your mindset changes. You stop anticipating problems. You start trusting your body again. Consistency is the deciding factor here. Doing this once or twice will not create lasting change. But 1 minute a day practiced regularly teaches the muscles and nerves a new baseline. Over time, the body learns that it does not need to stay guarded. This approach also aligns with how men age well. At this stage of life, the goal is not intensity. It is efficiency. Small targeted actions that remove obstacles are far more effective than extreme efforts that create more stress. What remains now is bringing this into a simple takeaway you can remember easily and apply without hesitation, so this becomes part of your routine rather than something you forget after today. Let us close this by simplifying everything into something you can actually live with. 1 minute a day, gentle pressure, consistent timing. That is it. You are not forcing anything. You are removing what has been in the way. When you release chronic pelvic tension, you give blood flow a clear path. When circulation improves, nerve signals sharpen. When the nervous system feels safe and unguarded response becomes more reliable. This is not about chasing youth. It is about restoring function that your body is still capable of when the environment is right. The men who benefit most from this are not the ones looking for instant results. They are the men who understand that progress after 50 comes from alignment, not intensity. 1 minute every day does more than 10 minutes once in a while. Consistency teaches the body a new normal. If you decide to start, choose a time that fits your life. Morning if you want to support circulation and awareness as the day begins. Evening if you want to release tension and help your body unwind. Pair it with slow breathing. Stay relaxed. Let the nervous system lead. Pay attention to small changes. A sense of warmth, less tightness, better comfort when sitting or moving. Over weeks, many men notice steadier response, improved control, and a quieter confidence that comes from trusting their body again. I want to be clear about one thing. You are not broken. You are not past your prime. You are simply working with a body that has adapted to years of stress and habit. When you give it the right signal, it responds. If this message was helpful, support the channel by liking the video so more men can find it. Leave a comment and tell me where you are watching from in the United States or around the world. This community matters, and your voice matters. Before we close, let me remind you that this video is for educational purposes only and does not replace professional medical advice. Every man's body is different. If you have ongoing concerns or medical conditions, please speak with your healthcare provider. I am Dr. Laura Simmons. Take one small step today. 1 minute, one habit, one. Because when you remove what is holding your body back, strength, confidence, and control have room to return.